Hey everybody, I'm Dr. Strong. Thank you so much for coming back, or if you're new, thank you so much for watching this video. Today we're going to be talking about the supplement that changes everything, especially when it comes to neuropathy or nerve damage. So I've got a full list of things that we need to go over so you can understand what alpha lipoic acid is. And then at the end, I'm going to give you a specific protocol so that you can start using this immediately to start healing your nerves and to get to feeling better. And this is something that I use with all of my patients virtually and in my clinic. So I wanted to make this video to help as many people as possible. If you haven't already, I really appreciate it if you like or subscribe. My goal is to get to 10,000 subscribers and we're right there. So it really means a whole lot to me. It helps me make videos like this to help people like you get better or your loved ones. And if you have somebody who has neuropathy or they have nerve damage, if you share this to them, I'm sure that they would appreciate it. So let's go over this. So change this video up just a little bit as far as structure. So I'll just put this in a Word document. This way it's easy for me to share with you. If you want the Word document, just let me know and I can send that over to you. But alpha lipoic acid, it's the #1 supplement for reversing nerve damage. And ALA, which is what it's known as, you might have heard of it, but I guarantee you don't know why it works or exactly, how it helps reverse nerve damage. So alpha lipoic acid is what we call a universal antioxidant because it works in both water and fat-soluble environments in your body. And this is crucial when we talk about nerve health because your nerves are surrounded by a fatty protective sheath called the myelin sheath. You may have heard of that before. And so here's what makes ALA so powerful for nerve regeneration is that it crosses the blood-brain barrier. This means that it can directly protect and heal the nerve cells in your brain and spinal cord. How cool is that? And it regenerates other antioxidants. So ALA actually recycles vitamins C and E, making them more effective at protecting your nerves. And it improves cellular energy production. So your nerve cells need massive amounts of energy to function and heal. ALA helps your mitochondria produce more ATP to carry out these regenerative processes. It also reduces inflammation. So chronic inflammation is the biggest enemy that we see of nerve health. This is why with diabetics, you got to keep your blood sugars in under 140. Otherwise, you're constantly getting nerve damage. And it's just like trying to rebuild a house that's on fire. And instead of putting the fire out first, you just start rebuilding the house. And that doesn't make sense when you're talking about repairing nerve damage. So the science behind nerve regeneration, I want to explain to you what's actually happening in your body when you have nerve damage and how alpha lipoic acid actually fixes it. When your nerves are damaged, whether from diabetes, chemotherapy, alcohol, or other toxins, there are several things that happen. The first is free radical damage. Your nerve cells are bombarded with harmful molecules called free radicals, and these damage the nerve cell membrane and the DNA inside the cell. And it also influences the mitochondrial dysfunction. These are the powerhouses of your nerve cells that stop working properly, so your nerves don't have enough energy to function or repair themselves. And this is why it takes a very integrated approach to address every single one of these issues, but this is a very good starting point for anybody out there who's suffering and doesn't know where to begin. The next thing is that inflammation. Your immune system creates chronic inflammation around damaged nerves, which actually prevents healing and causes more damage. So while inflammation is a necessary component to it, depending on if you have high blood sugars or if you're undergoing chemotherapy, radiation therapy, if you have dietary stress, if you have bacterial infections, parasites, fungus, whatever it may be, it can be very hard to address the nerve damage if you don't address those things first. Now, poor blood flow is something that we see constantly in all of our patients. This is because not only do these things that damage the nerves, they also damage the microvasculature in the hands and the feet in particular. And with this damage, what we know is that we can't deliver these nutrients. So this is why supplementation isn't always as effective, because if the roads are damaged, there's no way for us to get the supplies to the nerves so that they can repair. And we also can't get oxygen to the nerves efficiently or effectively so that they can start the repair process. And oxygen is needed in almost every metabolic process in your body. So alpha lipoic acid addresses all of these problems simultaneously. It's like giving your nerves a complete repair kit. Now, there are other things that I suggest besides alpha lipoic acid, which I'm going to go over at the end of the video. But like I said, this is just a very general overview for you. So there was one groundbreaking study published in the diabetes care, and patients with diabetic neuropathy who took 600 milligrams of alpha lipoic acid daily for 3 weeks saw significant improvements in their pain, burning, numbness, and tingling. But here's the key: they used the right form and the right dosage. It's just like a cake recipe. If you don't have all the right ingredients, you're going to get a poor result. And this is where a lot of people go wrong, is that they're not using a therapeutic dosage to get the therapeutic benefit that they're looking for. And that's what we're going to cover next, is why most people don't get results. So here's where most people go wrong with alpha lipoic acid and why you might have tried it before without success. Problem number one is that the wrong form. Most supplements contain regular alpha lipoic acid, which is poorly absorbed. Your body can only use about 30% of what you take. So in order to get the most effective dosage, you'd have to do 3 times of just the regular alpha lipoic acid. The superior form is R-alpha lipoic acid, which is the naturally occurring form in your body that recognizes and absorbs much better. So you'd have to take 3 to 1 of the regular alpha lipoic acid versus the R-alpha lipoic acid. So, not only is that going to save you a lot of money, but it can also help you get better results. Problem number 2 is the dosage is too low. People taking 100 to 200 milligrams and wondering why they don't feel better, that's because they're not using that therapeutic range for nerve regeneration, which is 600 to 1200 milligrams daily. And this is divided into 2 or 3 doses. Most of the time I do it all in one dose to make it easier for my patients, but you can spread this out throughout the day. You just have to be aware that you need to take it. And then problem number 3 is poor timing of alpha lipoic acid. It should be taken on an empty stomach for maximum absorption. Taking it with food reduces the absorption up to 50%. When we have patients that have stomach issues when taking supplements, we do tell them to take food, but that's only because they may have some leaky gut or other digestive issues that we need to address first so that they can absorb the other supplements more effectively. Problem number 4 is not taking a long enough nerve regeneration. It takes time. And so you might feel some improvement in pain within 2 to 4 weeks, but true nerve healing takes anywhere between 3 to 6 months of consistent supplementation. Most of my patients were working with anywhere between 6 to 15 months because just depending on how long the nerve damage has been there, what is causing the nerve damage, are they doing any other factors, like are their blood sugar still high, are they still smoking, are they drinking? Because those things are things that we have to address before we can actually start making progress. And then problem number 5 is not addressing the root causes. So LAA works best when you're addressing what caused the nerve damage in the first place: diabetes, blood sugar control, toxin exposure for autoimmune induced neuropathies, nutritional deficiencies, etc. It's hard, especially if you have cancer and you're going in under chemotherapies or radiation therapies. You got to do what you got to do, but there are things that you can do to help make that nerve damage less when you're going through those therapies. So here's the complete nerve regeneration protocol. So while ALA is the start of the show, it works even better when combined with these supporting nutrients. So B vitamin complexes, especially 1, 6, and 12. Your nerves are literally made of vitamins, B vitamins. So B1 is crucial for nerve energy production. B6 helps with the communication, and 12 is essential for myelin sheath repair. A lot of people talk about B6 toxicity. It's very rare. I don't see it a whole lot. I think it's a misdiagnosis for most people. Most of the time it's probably you have a digestive issue that's causing that, or you have the wrong form of B6 that is causing the issue. So high potency B complexes with at least 100 milligrams of B1, B6, and 1,000 milligrams of the B12 are essential in order to get, like we've been talking about, the therapeutic therapeutic dosage to cause nerve regeneration. The next supplement is acetyl L-carnitine. This amino acid helps transport fatty acids into your nerve cell mitochondria for energy production. It also helps. It also has neuroprotective properties. So you want to do anywhere between 1,000 to 2,000 milligrams daily on an empty stomach. And then magnesium glycinate. So a lot of people are deficient in magnesium because they're not eating green leafy vegetables. And magnesium is involved in over 300 enzymatic reactions in your body, including nerve function. So most people with neuropathy are magnesium deficient. We see it all the time because they're getting cramps, they have weakness in their legs, and this magnesium can help. A powder form is usually what I recommend, but you can take like a topical and you can rub it on the area and it'll get absorbed through the skin. 400 to 600 milligrams daily before bed is a good tool. How you know if you're doing too much magnesium is typically you'll have loose stools. So you want to avoid that, or you want to reduce it down or take a smaller dose. At different intervals can help with any type of loose stools. And then omega-3 fatty acids, this is like in fish oils, this is found in nuts and seeds. These are essential fats that are crucial for nerve membrane health and reducing inflammation. 2,000 to 3,000 milligrams of combined EPA and DHA daily is what I recommend. So here's how we take alpha lipoic acid for the maximum results. Here's my exact protocol for reversing nerve damage. So weeks 1 to 2, start slow. Begin with 300 milligrams of our alpha lipoic acid twice daily. Take on an empty stomach 30 minutes before meals and monitor for any digestive upset. Rare, but it can happen. And then that's when maybe you do have a digestive issue. Check out my videos on gut health and that we need to address first. Weeks 3 through 8 are the therapeutic dosing, so we want to increase to 400 milligrams 3 times a day, 1,200 milligrams total, and then continue taking on an empty stomach if you can tolerate it. And this is where you should start seeing some improvements, okay? Months 3 through 6 are maintenance. You can often reduce to 600 milligrams once your symptoms start improving, but some people need to stay on a higher dosage for a longer term. Now, you can work with a healthcare provider to find your optimal dose if you want more guidance, but I make these videos to help give you as much information as possible just with my clinical experience. So important notes is that you want to take a small amount of biotin to prevent biotin deficiency. If you're diabetic, monitor your blood sugars closely. That's why CGMs are great, continuous glucose monitors. And ALA can lower glucose just like with berberine. You've got to be careful about that. You're not dropping them too low. And start slowly if you have a sensitive stomach. So here's what to expect in your timeline is that weeks 1 through 2, possible slight increase in nerve sensations. This is actually good. It means the nerves are waking up. We have to be able to identify when, like for working out example, a good pain is a good pain and a bad pain is a bad pain. And sometimes it can get confusing. But just because you have slight increases in tingling or burning, it doesn't mean that it's bad. It could mean that the regeneration process is starting. If it continues for longer and continues getting worse, then you may need to, consult with somebody or look at something different. Weeks 3 through 4 are noticeable reduction in burning, tingling, and shooting pains, better sleep due to less nighttime nerve pain, and then improved balance and coordination. This is huge for a lot of my patients because they do suffer with balance and coordination issues. Months 2 through 3, significant improvement in numbness, return of sensation in previously numb areas, and reduced need for pain medication. Month 3 through 6, continued nerve regeneration, return to normal activities, and some people achieve complete reversal of symptoms. However, that is not everybody. And remember, everybody heals at a different rate. Factors like age, severity of nerve damage, underlying health conditions, and how long you've had neuropathy all affect healing time. And then the most common mistakes that I see that sabotage results why you're not getting better is that expecting overnight results. Nerve healing takes time. Don't give up after just 2 weeks or a week. This takes a long period of time. And then mistake number 2 is taking with food. This cuts absorption in half. Always take on an empty stomach if you can. Mistake number 3, buying cheap supplements. Quality matters. Look for an alpha lipoic acid R form that is from reputable manufacturers. And then number 4 is not addressing blood sugar if you're diabetic and your blood sugar is out of control, and then no supplement will work optimally. And number 5 is continuing nerve damaging habits. You can't out supplement a bad lifestyle, especially for smoking or drinking. So this is where you have to cut those out. I don't even accept patients that continue to keep smoking or drinking when it comes to helping them. So reduce alcohol, avoid toxins, and try to manage your stress as best as you can. So safety interactions just to be aware of is possible side effects can indicate could be a mild upset stomach, a skin rash, very rare, low blood sugar, monitor that very closely. Drug interactions can enhance diabetic medications, but work with your prescribing physician or another doctor to help correlate that and measure your sugars often. May interact with thyroid medications, can chelate metals, so separate from iron supplements by 2 hours. And who should be cautious with this? Pregnant or breastfeeding women, people with severe liver disease, and those taking chemotherapy. Talk to your oncologist, shouldn't be an issue. We've never had an issue with it before. And then always work with a healthcare provider, especially if you're on medications. So here's your action plan for today is get a high quality R-alpha lipoic acid, 600 to 1200 milligrams daily, add a high potency B complex vitamin, start taking on an empty stomach 30 minutes before meals. Be patient and consistent. I know it's frustrating. We're in a culture now where we expect everything right this minute, and then give it at least 3 months. And then you want to address the underlying causes, so blood sugar, toxins, stress, all of that. Okay? So thank you so much for taking the time to watch this. If you would like this PDF, then just let me know and just comment me below, and I'll put that together. I'll put a little link on here and I'll comment that to you, so you can just download this so you don't have to go back and watch this a million times. And then I'm also going to put some free resources in the description section below. And yeah, let me know your thoughts, how I can improve, and if this was helpful. All right, everybody, have a great day. Please, like I said, my goal is to get to 10,000 subscribers. Like and subscribe if you haven't already. All right, everybody, talk to you soon. Bye.